Good afternoon, everyone. This is Nirav Shah from the Maine CDC. Thank you all for joining us this afternoon. I'd like to now turn things over to Governor Mills.
Good afternoon, and thank you, Dr. Shah. Thank you for your devoted service to the people of Maine during these difficult periods we've incurred. Yesterday, you read, nearly 9 months after the pandemic began, Maine marked a tragic milestone. Our state surpassed 1,000 people who lost their lives with COVID. Our whole state, our communities are lessened by their loss, the loss of these loved ones, the parents, grandparents, siblings, children, friends, and family taken from us by this deadly disease. People like the 40-year-old Bath Iron Works worker who hadn't gotten around to getting vaccinated. People like the 57-year-old musician who died 1 week before he was due to get his first vaccine. People like the 75-year-old engineer who tested positive the day before he was scheduled to be vaccinated. I want to thank the members of the media for working with the families of these individuals who lost their lives in order to tell their stories. And I encourage everyone to read those stories. In each word, you can hear the heartbreak that comes from needlessly losing someone you love. It's the families of many of these people who are speaking out and who indeed are urging people to get vaccinated. Along with the more than 1,000 deaths now, we now have a record number of Maine people in hospitals, including a record number of people in ICUs. The vast majority of those people hospitalized with COVID are unvaccinated. Many of those people are ones who said to themselves, it can't happen here, it can't happen to me. And now their families too wish they had listened to medical advice and simply gotten the shot. Now many hospitals are saying, if you need surgery, if you get into an accident, if your doctor says you need an important procedure, at some point soon, you may not be able to get that procedure. There may be no room for you. COVID patients right now are taking up 226 hospital beds, and tragically, 88 of them are in the ICUs. 40 of them are on ventilators, fighting for their lives. Again, the vast majority unvaccinated. If people for some reason don't believe this, just watch the videos, read the news, listen to the doctors and nurses who are speaking out, who are telling you the truth, who are begging you to get vaccinated. Truly, there is no downside, only a benefit. A benefit to you, to your family, to all of our children, and to people you may never have met. This is a crisis that's preventable. I remember, and you'll remember, a year ago, we were working hard to contain the virus. We had some tools, we had some testing, we had masking and distancing and protocols, but we prayed for a vaccine. We hoped beyond hope for the miracle of a vaccine. Last year, we only had a couple tools to use to spread the virus. Washing our hands, keeping our distance. We needed that vaccine to let us live our lives again, to let us open our classrooms again, to let our economy thrive again, to let us return to normal again. And today we have 3 vaccines, and they are safe, they are free, and they save lives. They're widely available all across the state of Maine, drugstores, doctors' offices, many public places. Please, I urge you, if you haven't gotten vaccinated, if you have doubts or questions, just talk to your doctor and then roll up your sleeve today. To that same end, I want to highlight some good news out of Millinocket, where Chief Executive Officer of Millinocket Regional Hospital, Robert Peterson, boasted this week that 100% of their hospital staff are now vaccinated. In thanking his staff, Mr. Peterson said, quote, Our local Millinocket Regional Hospital staff have been true heroes throughout these dangerous times. They've put their lives on the line for all of us and once again have demonstrated their commitment to safety by agreeing to get vaccinated. 100%. Thank you, Millinocket Hospital. Thank you for putting the health and safety of others and your patients first. That's important progress, and it shows what can be done when people step up to do the right thing. I hope our heroic healthcare professionals who haven't yet been vaccinated will soon follow the lead of those in Millinocket. Of course, healthcare facilities are not the only place that care for our most vulnerable. Our public schools are directly responsible for the safety of Maine children, thousands of them, many of them not old enough to be eligible to be vaccinated yet. We owe something to them too. We owe a duty of protection and care to those kids. Almost 76% of all school staff in Maine are fully vaccinated, but there are dangerous exceptions. Some schools are as low as 20% of staff who are fully vaccinated. 20%. On a related note, according to the Maine Department of Education, it appears that the vast majority of students are in schools with universal masking policies. But here again, there are some dangerous exceptions that risk spreading the virus to school children, teachers, and staff. Last week, the Department of Education released a dashboard indicating that in the last 30 days, 1,390 cases of COVID-19, 1,390 cases, and 52 outbreaks were reported associated with Maine schools. These numbers continue to climb. We're not powerless. We can keep schools open safely. Public health officials, including the US CDC, say that masks should be worn inside school settings, and it is my firm expectation that every school in Maine will follow that advice, the advice of all of our public health officials. Every school in Maine should require universal masking, period. Every staff member of a school, including teachers, bus drivers, custodians, secretaries, nurses, aides, and others, should be vaccinated as well. And parents, please vaccinate your kids. Get your children vaccinated if they're age 12 or older right now. Protect them, protect others. I want to be clear too. If you're taking care of Maine kids and you're choosing not to get vaccinated, you're saying that you are more important than the children who are in your care. If you're a school board member, if you're an administrator, if you're a school district that's not requiring universal masking, you're endangering the children, the staff, the teachers, and everyone who enters that school. Please just get vaccinated. And whether vaccinated or not, wear a mask. Prove what we all know to be true, that Maine's public schools can be the best in the nation at protecting our kids and providing a quality education. We want kids back in the classroom. We all do. They've got to be safe. Do this. Get a vaccination. Mask up. Do it not because somebody else tells you to and not just because it's good for you alone. Do this because it's the right thing. It will save lives. You've been watching the series perhaps on Muhammad Ali this week, and it brought to mind something he famously said years ago. Quote, "Service to others is the rent you pay for your room here on earth." End quote. Getting vaccinated, wearing a mask is serving others. As Pope Francis put it just a few weeks ago, vaccines, he said, quote, "grant us the hope of ending the pandemic." Vaccination is a simple but profound way of promoting the common good and caring for each other, especially the most vulnerable, he said. He termed vaccination, quote, "a gesture of love," end quote. I call on all community leaders, public officials, educators, business people, union members, faith leaders to speak up and let everyone know that there is one way out of this pandemic, one way, and it is simple, it is painless, it is selfless, and it is critical. Vaccination. Our rent is due. The rent Muhammad Ali referred to. Let us show the nation that Maine people are selfless and that we can put aside any political, social, or philosophical differences and that we agree we all need to protect our children and we need to protect the most vulnerable among us, especially. We need to protect our hospitals. We need to protect one another, as so many of you have done throughout this pandemic to date. So thank you for listening today. And Dr. Shah, I will turn things over to you for your weekly update. Thanks.
Thank you very much. Thank you very much, Governor Mills. I'll provide a bit of an epidemiological update on where things stand before we turn to our colleagues in the media for questions. As the governor referenced, we are now at over 1,000 deaths in Maine associated with COVID-19, 1,007, sadly, to be exact. Of those, Maine CDC is reporting an additional 5 deaths associated with COVID-19 today alone. They include a resident of Androscoggin County, a resident of Aroostook County, and 3 residents of Penobscot County. 1 was a woman and 4 were men. 1 was in their 40s, 1 in their 50s, 1 in their 70s, and 2 in their 80s. 4 of the 5 deaths reported today were the result of Maine CDC's periodic review of death certificates from our vital record system. And those 4 deaths occurred between September 7th and September 12th of this year. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of all those who have passed away with COVID-19 throughout the pandemic. Statewide, Maine CDC is now reporting 85,156 cases of COVID-19, an increase of 614 cases since yesterday. Our team of epidemiologists continues to review positive laboratory reports that are electronically submitted to Maine CDC, and as of this morning, we had approximately 3,000 laboratory results that were awaiting review. Right now in Maine, there are 226 people hospitalized with COVID-19. As the governor mentioned, 88 of those individuals are currently in the intensive care unit, a sad and dark record today. 40 of those individuals are on ventilators. Comparing those numbers against 2 weeks ago, we see significant increases. 2 weeks ago, 187 people were in the hospital, 67 were in the ICU, and 32 were on a ventilator. Statewide, of 342 ICU beds that exist, 46 are available as of this morning. In terms of testing, there are some small signs of optimism there. Our PCR positivity rate on a 7-day rolling average now stands at 4.45%. 1 week ago, that positivity rate was just over 6%, 6.06 to be exact. Similarly, with respect to PCR testing volume, our PCR testing volume currently stands at 584 PCR tests for every 100,000 people. 1 week ago, that number was at 477 for every 100,000, a significant amount of growth just over the past 7 days. And finally, an update as to where we stand with respect to vaccines and vaccinations. Right now, Maine is administering about 2,400 doses of COVID-19 vaccine every single day. That represents a 20% increase in vaccination rates just over the past incubation period, over the past 14 days. We've risen from administering about 2,000 doses a day to now about 2,400. What that means as a state on a population level is that 73% of the entire state, of every single person in the state, has received at least 1 dose. And about 2/3, about 2 out of every 3 people you meet on the street right now in Maine is fully vaccinated. I want to take a second to note one other really important statistic. In terms of vaccination rates for those who are at higher risk, for example, those who are over the age of 65, the numbers are encouraging and striking at the same time. 93% of Maine people over the age of 65 are fully vaccinated, and a striking 98% of people in Maine over the age of 65 have received at least their first dose. Those are first-rate numbers, and I'd like to thank the people of Maine for doing their part and getting vaccinated, as Governor Mills mentioned. With that, I'd like to turn things over to our colleagues in the media for questions. Let me turn first to Chris Costa.
Hi, everybody. Thanks for taking our questions today. If you don't mind, I'd like to ask Governor Mills a quick question. Governor Mills, we saw with the Department of Labor and OSHA rule that came out from President Biden's COVID plan, people who work at employers of 100 or more must either get vaccinated or provide a weekly negative COVID-19 test result. It's become apparent that some Republican members of the Maine legislature have submitted a request to you to include that type of weekly negative test result as an option for healthcare workers that are currently under a mandate to get the vaccine. Have you given that any consideration?
Sure. We talked about that early on. Thank you for the question, Chris. It's not a new idea, not at all. Been talking about it all year, but when it comes to healthcare workers, here's my concern. If you have to go into the hospital for surgery, if your mother, grandmother has to go into a nursing home for however long, for rehab or whatever, and if you have to go in for a procedure in outpatient status, you would want to make darn sure that everybody who took care of you or your loved one was fully safe, fully vaccinated, whether it was measles or diphtheria or COVID-19, which is so highly transmissible. You would have that expectation. I have that expectation of healthcare workers. And unfortunately, a testing alternative just doesn't cut it, doesn't do the job of keeping patients, vulnerable people, safe as possible.
Can I just ask you to expand as to why not a weekly testing option? And perhaps maybe Dr. Shah or Commissioner Lambrew could provide some insight as well.
Well, I mean, they can tell you what testing does. We've discussed that in the news briefings quite often. But the fact is, you could have COVID-19 and be at work and be spreading it before you get tested on that Friday or whatever day of the week it is you choose to get tested. And you could be spreading it in dangerous situations, transmitting it to patients who are very vulnerable, people in your care. And that's the highest risk, and that's the danger we're trying to address there.
Sure, and I'll just add 2 points, Governor. One is that we also recognize that our healthcare workers themselves are at risk. I mean, as a reminder, they are on the front lines caring for people with COVID-19. So protecting those workers is equally important. And that is why the president announced nearly 2 weeks ago that there will be a nationwide policy for all healthcare workers who are receiving Medicare and Medicaid funding to be vaccinated without this alternative of tests. So there is something qualitatively different about healthcare workers. They are caring for people with COVID-19. Those people themselves who don't have COVID-19 need protection, which is why President Biden followed Governor Mills' lead and is requiring all healthcare workers in the coming months to get vaccinated.
Thank you. And my second question, Governor, since you talked about children a lot, I know that I've asked this question previously, so if you don't mind, Dr. Shah and Commissioner Lambrew, please bear with me. Childcare centers, they deal with some of the youngest children, some who, if they're under the age of 2 are not able to wear a mask. And as a small business, some of these childcare centers fall into what appears to be a bit of a gray area. These kids are too young to be vaccinated. They can't wear masks. And I've heard from many parents who are concerned about some of the protocols that some of the childcare centers have been putting into place. They feel that it's not protective enough of these young kids who they feel are very vulnerable. I know that DHHS has encouraged all the childcare centers to follow the US CDC guidance. And so I guess my question really for all of you, if you don't mind weighing in, is the guidance from the CDC enough, or do you think there should be more regulation for childcare centers in particular?
Jeanne, perhaps you can address the CDC guidance better than I, but if I were a parent, I would have those same concerns and be asking every day whether or not the staff in that daycare facility where I place my children are fully vaccinated and wearing masks. I understand that kids under 2, it's very difficult for them to wear masks, but I would want to make sure that the protocols are followed in every other respect to safeguard not only my child, but other children in the facility and the staff themselves.
And we have been providing childcare facilities with access to testing. We're going to try to expand that in the coming weeks. We do think that the US CDC guidance for childcare providers is solid, evidence-based, and have been urging, as Governor Mills did with schools, strongly urging them to take up that set of guidance. That guidance does evolve over time, which is why we do periodically encourage our childcare providers to look at it again. And again, we had special vaccination clinics in the spring to try to target some of these workers like childcare workers. And we really do encourage every childcare worker in the state to get vaccinated.
Thanks a lot, Chris. Let me go to Patty White next.
Thank you very much. I'm going to ask a question that also gets asked a lot in these briefings, but Governor Mills, you strongly encouraged school staff to get vaccinated, saying that if they don't, they're endangering children. So at this point, why not require staff to get vaccinated?
I think we're getting there, not in terms of a requirement, but I've been speaking to leaders in the education sector and getting them to speak out and doing a lot of one-on-one communications, conversations with those who may be still hesitant. And I think we are getting there. We're raising the level, the percentage of people vaccinated, staff who are vaccinated, including teachers in the schools. Secondly, we're also raising the number of school districts who are requiring masking. As you know, we have a system of local control in our state, and I treasure that system of local control. I watch carefully as school boards deliberate very vigorously sometimes, masking requirements. And I know that teachers are weighing in every day, and staff of these schools are weighing in every day on what can keep them safe and keep their kids safe. So I fully expect people to do the right thing because it's the right thing, not because it's a mandate.
Okay, thank you. And Dr. Shah and Commissioner Lambrew, I saw that the dashboard for vaccinations for healthcare workers has been updated. Can you just point out anything that strikes you about, what's going well and maybe where you're going to focus your ground game over the next few weeks?
Sure. So we did update our dashboard as a monthly dashboard, and as of August 31st, because there's a little bit of a time delay in between when we get the data and when we post it, as of August 31st, 85% of staff in hospitals were fully vaccinated, as well as 77.2% of staff in nursing facilities. That's progress in the couple of weeks since we announced that new requirement, but we've had even more time between that point in time, August 31st, and now. We meet with hospitals, the associations regularly. We continue to track their progress, learn their lessons, propagate those lessons. As Governor Mills said, we're excited to see Millinocket Regional Hospital announce that it is at 100%. As of August 31st, we had 7 hospitals that were over 90% in terms of their vaccination rate and 15 nursing facilities. So we continue our work on the types of information that people need, one-on-one kind of counseling, as well as providing those facilities with vaccine doses to help them achieve this new safety standard.
Thank you. Dr. Shah, sorry, did you want to add anything?
No, nothing else from me, Patty.
Okay, thanks.
Thanks. Over to Joe Lawler next.
Yes, hello. Just a couple of questions. One, just kind of a clarifying question. I know you said that the positivity rate has gone down to 4.45% from a week ago. And I'm wondering, is there any apples to oranges comparisons there, or is it all apples to apples? In other words, was there some big data dump of surveillance testing, for instance, that might have caused that downward decline, or is that a true decline? Thank you.
Yep. Thanks, Joe. So, the positivity rate, the numerator is the number of positive PCR tests reported in electronically. Denominator, number of PCR tests, both over the last 7 days. There have been contributory factors from both the numerator and the denominator. We're starting to see a very, very slight, but perceptible decrease in the number of new positive cases every day. It's too early to tell whether it's a trend, so I'm not using that word, but it's been there. And then similarly, testing volume, as I mentioned, has also gone up. So it's a combination of both. But Joe, to your particular question, this is not artifice because of a particular lab that had 3 weeks of data that it just dumped on us. That is not what's happening. All of these numbers are real time as of midnight of last night.
Okay, thanks. And just to like kind of assess I know you said that in particular is not a trend yet, but assessing the other trends and seeing what's going on in the rest of the country where we have seen a decline in virus prevalence in much of the rest of the country. Do you think that is on its way to Maine or too early to tell? How would you assess that?
A combination of too early to tell and can't speculate. Here's what's on my mind, though, Joe. We have started to see a little bit of easing in some states, similar to what we saw in the UK around about 4 to 5 weeks ago. What's on my mind and the mind of other state health officials is if this is the beginning of a decline, will it be a precipitous decline, so-called exponential decay, or will it be a reduction followed by a high plateau, which is what happened in the UK for a while? Too early to tell on all of that, but stay tuned, which I know you will.
If I could just squeeze in one more little thing. I noticed that I think you said that hospitalizations, the percentage of vaccinated people who require hospitalizations seems to have gone up, but yet the ICU numbers are still very high with unvaccinated individuals. So could you explain that phenomenon a little bit?
Joe, yep, I want to. Yes, so a couple of things. The first is this is minor, but I want to just make sure we're clear. It's not the percentage of vaccinated folks who require hospitalization. It's the percentage of those who are hospitalized that are vaccinated or not fully vaccinated, and that's plateaued
what I meant,
out.
yes.
Yeah, no, just wanted to. I know you did. I just wanted to make sure for everyone tuning in, that former number has plateaued out. It varies a bit week by week, as you would expect with any number, but it's plateaued out to be anywhere from 2/3 to 3/4 of people in Maine hospitals who are not fully vaccinated at any one time. And again, it varies from week to week. ICUs are different though. What we're finding in the ICU is that in any given day, any given week, 90+% of those in the ICU are not vaccinated. What's going on there is that those folks are often not coming to the hospital soon. They often wait until they're later in their course of care before they present. And that means when they enter the healthcare system, they might be sicker to begin with, thus necessitating higher needs for ICU care. ICU care is difficult, it's challenging, and what we're seeing almost uniformly in Maine, as well as across the country, is that those who are in the intensive care unit, 90+% are not vaccinated. Let me go to Brian Sullivan at WABI next.
Thank you, Dr. Shah. My first question is about capacity, and I'm not sure if the term is correct, but field hospitals, I believe is what we called them previously, and I would wonder if that's being considered, and I guess I would just wonder where they might be, thinking that a lot of the spaces where they were previously are probably occupied, like in Bangor, I believe the Cross Insurance Center was a planned location. So just if that's being considered, and if so, where?
Sure. Maybe I'll take this one, Dr. Shah. So at the beginning of the pandemic, we brushed off plans for what are called alternative care sites to make sure that they were up to date, that we had active staffing capacity, that we were adapting those sites to the potential needs of COVID or non-COVID patients, whichever the circumstances required. Those plans exist. They're ready as needed. That said, virtually across the state, there's an agreement that we want our patients to be cared for in hospital beds. So what we've done, and this has been helped by the advance of therapeutics to treat people with COVID-19, knowledge about how to care for people, we've been able to use beds across the state and our rural hospitals and our smaller hospitals, as well as our larger hospitals, to care for people with COVID-19. And that is the preference. We want to keep people in beds where possible. As Director Shah said, we are hovering in the 40s and 50s in the number of available ICU beds, which is within the margin that we don't think we need to get to that next level of planning. Should we get closer to that next level, we will roll up our sleeves and work with our facilities, but we will do anything we can to avoid having a person who needs healthcare in insurance arena or in a gym. Our goal is to maximize our capacity in our hospitals as needed, in homes with home care, as needed in nursing facilities, whatever we can do to care for people where that qualified staff are with the type of equipment that they need in the type of quality setting that they deserve.
Thank you. And a question for Governor Mills. Governor, I'm not sure if you'd heard, but there is an event just down the road tonight where it's widely expected that former Governor Paul LePage is going to announce that he is running in 2022. I apologize if I hadn't heard anything from your camp yet, but is it your intention to seek a second term? And do you have anything to say about a possible opponent?
I don't intend to talk politics. I think it's way too early to be talking about campaigns. I don't think the people of Maine want to hear about campaigns at this stage of things. We're fighting a pandemic. We're trying to save lives and keep people out of hospitals, out of the ICUs, off of ventilators. We're trying to reopen our schools. We're getting our economy back on track. That's what I'm focused on right now, and really nothing else.
Okay, I commend you and I thank you for your trying to get more people vaccinated, but I am a person of Maine and I would love to hear if you do plan to seek a second term in office.
This isn't the proper venue or the time to talk about elections, Brian. Thank you, though.
Okay, thank you.
Thanks, Brian. Over to Emily at the Sun Journal next.
Hi, good afternoon, everyone. So I think this first question is either for Commissioner Lambrew or Governor Mills. I read a notice from DOE Commissioner Mackin last week or earlier this week regarding the state plan agreement with OSHA. So meaning that it was my understanding from this letter that the Biden's mandate for private companies with 100 or more employees will apply to public sector employees. And I'm just hoping I could get some clarification on that.
Well, yeah, I can start by saying, I believe I said earlier, and I'll repeat that we are waiting for the rule itself. Nothing's been finalized or drafted or promulgated that we can examine. You know, I like to look at the language of something before I opine on whether it fits this or that. So we're waiting for the language of the federal rule. And then to see how it applies to the state, what sectors. We believe it'll apply through the state to public sector employers. Beyond that, I'm going to wait for the language of the rule.
Okay, and so my next question, I think this will be for everyone. Dr. Shah, I know you don't like to make predictions, but I'll phrase it a different way. If the pandemic kind of, if cases continue at their current rate, if hospitalizations stay this high, in your opinion, what's at stake here? I'm not going to ask you what's going to happen, but what's at stake if things continue the way they are right now?
I'll start, Emily, but as you noted, I'd love for Governor Mills and Commissioner Lambrew to weigh in. For me, when I look at the numbers on a daily basis and talk with our teams every single day, what's at stake with the current numbers and the trajectory that we're on is nothing short of people's lives. We've reported deaths over the past few days at levels that we haven't really seen since December or January, at a time when vaccinations were nascent. And yet here, with vaccination rates so high, it's understandable that people are wondering how we got here. But of course, what really the human impact of this is our friends, our neighbors, our parents, our family members. They're the ones who are getting COVID and dying from it right now. What's going on there, Emily, is a reasonable question that I've seen a lot of folks ask and pose in different fora on social media and elsewhere. And generally what's happening, if you look at Maine and many US states compared to other places in the country, something that you see a lot in epidemiology, which is it's not just the raw number of folks who are vaccinated, 67%. It's also the distribution of where they are vaccinated in relation to others who are and are not vaccinated. Generally speaking, one of the things that's driving cases in Maine are clusters of folks who are not yet vaccinated. That's where we're starting to see, or have been seeing, a lot of the transmission that's generating the hospitalizations, the intensive care unit stays, and sadly the deaths. So that's what's at stake right now.
I'll just add, obviously, what's at stake as well, if things don't change for the better soon, is the education and well-being of our children. As I said earlier in my remarks, people need to get vaccinated so that we can keep our schools open. You see school boards who once said, well, we don't need to require masks, changing their minds because they've had illness, outbreaks, quarantines. That's happening. And more school districts are coming around to not just the notion, but the fact and the medical fact that masking helps reduce the transmission of the virus, especially when you're in a school with kids who aren't eligible to be vaccinated. So what's at stake here is childcare, children's education and their well-being. And, it's an economic thing. When you have children in school, you're not taking them out of school, having to keep them home. People aren't having to stay home with children or put them in daycare when they didn't have to otherwise. And it has economic repercussions. Many of the people whose children are taken out of school are healthcare workers who then can't get to work because they lack childcare. So it's cyclical. All these things are connected. So all of those things are at stake.
Thanks, Emily. Let me go to Brad Rogers next.
Hey, Dr. Shah, just a couple of quick questions. That 40 people on ventilators, is that a record number as well? And also,
Brad,
go ahead.
It's not a record. It's near the record. It's concerning either way, record or not, as you can imagine. But there have been a couple days where it's been above that even.
Yeah. And do you know the youngest the age in the hospital? Could you say that, or the range of age, if you can only say that?
Sorry, Brad, you cut out, but I think your question was the youngest person in the hospital, or the age range. We can get that for you, Brad. Don't have it in my notes immediately, but we'll see if I can pull that and have Robert Long send it to you.
Okay, and then one last thing: if the elderly, are so well vaccinated, you must think it's really falls upon the 12 to 40 and 50-year-olds. They're the ones who probably are under vaccinated, right? And what's your message to the younger people about the need to get out there and get vaccinated?
I'll start, but I know that the governor and the commissioner most certainly have pieces of advice there. Brad, I've seen so many folks on social media and elsewhere who have said, I don't need that vaccine because I'm young, I'm healthy, I don't have any health conditions, I'll be fine. My first question back to those folks is, are you healthy? When we think about folks who are at higher risk for COVID-19, there's a lot of health conditions that can land you in that category. Being overweight, having high blood pressure. So the first question is, do you really think you'd be out of the woods? But the second question I ask that I try to weigh in on, even on social media sometimes less fun as that is forget about you. Why are you only thinking about yourself? What about your parents? What about your grandparents? What about kids that you interact with who are too young to get vaccinated? Even if you truly would be okay, and maybe you wouldn't be, maybe broaden your view just a bit to think about those in your life who are at higher risk, people in your family, people in your community. That's to me, I think, just as compelling.
And I think there was a report in the newspaper yesterday of some of the people who have passed on with COVID, have died with COVID. And one of them was a 40-year-old individual. And it's reported that he was one of 17 Mainers in their 40s who have died with the virus. Well, that may seem like a low number, but if you're 40, 41, it could happen to you. And if you're under 40, it can happen to you as well. I think that you can't fool yourself into thinking that, well, if I get it, I won't be that sick. You may well also end up taking up a hospital bed that could belong to somebody else, where somebody else could get critical care for some other issue, some other medical problem. You may well end up in the ICU, like 80-something people today who are in the ICU in critical care. And you may be occupying, again, a critical care bed that could go to somebody else who's even more needy. Not getting vaccinated doesn't avoid the problem, and it only increases the risk.
Thanks, Brad. Let me go over to Caitlin at the BDN next.
Hey, good afternoon, everybody. One thing that I wanted to check, just to make sure I understand, the healthcare worker dashboard, that's inclusive of staff who are fully vaccinated, right? So it might not necessarily include people who decide to get their first shot after the requirement was announced?
Is accurate, yes.
Okay, great, thank you. My second question, I think kind of directed specifically to Governor Mills and Commissioner Lambrew. So we've dedicated money to support nursing homes and other care facilities to keep them open, but getting more people hired and vaccinated is going to take a certain amount of time. What can the state really do if more closings occur before then, as some industry experts fear will happen?
Well, first of all, Caitlin, I think this is thank you for the question. This is not an issue that's unique to Maine, not at all. We're seeing a shortage of healthcare workers across the country. And so even before this latest surge, we had started planning for certifications, allowing people from other states, other areas to be certified as healthcare workers in our state. We passed laws to that effect. We funded programs to train up healthcare workers. You know, we have the Maine community colleges, we have UNE, we have the University of Maine, who are standing up more nursing programs and CNA training programs than ever before. And we funded in the ARP bill, 1733, money for training and certification of healthcare professionals. And the $123 million that's going out the door now to nursing homes and hospitals to help fund the additional payments to keep people on board and to hire traveling personnel and that kind of thing, which, as you know, comes at a premium, is helping as well. So, and I've been talking with the nursing home administrators and with hospital administrators about their needs from day to day. And Commissioner Lambrew and Dr. Shah are in touch with them every day as well to see what we can do on the ground to help fill their staffing needs.
Okay, and I guess my second question is, has the state, and it's kind of a follow-up to that, has the state considered other methods, I guess, to try to boost staffing, particularly, I guess, at hospitals, like some other states have? I'm thinking about, them asking to recruit staff out of state, or like asking if states can send other people to help out, things of that nature.
Well, as I started to say earlier, it's a national problem. It's not unique to Maine. So when you ask people, other states to send people here, you're asking them to deplete their resources. So of course we would welcome healthcare professionals from other states and other countries. And we are doing that. And we have increased the flexibility of our reciprocity rules. The legislature did that, in fact, this session. We also have put $20 million into the ARP funding, the Maine Jobs and Recovery Program, which will be available as soon as possible, mid-October, because the effective date of the bill, to help pay back student loans for healthcare professionals of all sorts, and give incentives for people to go into the healthcare profession. Back when I was on the Appropriations Committee some years ago, we had the same issue. Everybody was saying there's a nursing shortage, there's a healthcare professional shortage. And we stood up programs at University of Maine, Fort Kent, and other campuses to train people in those fields. And we're still doing that. Some of this is pre-pandemic for sure.
Okay, just to be kind of clear on that, Governor, when you say that, we would welcome that, and certainly, it's no secret that the staffing shortage is a national problem, but has the state kind of put out an active call, as we've seen some other states where particularly hospital capacity is really strapped, saying like, can you send more people to our hospitals?
Well, we don't do the hiring. Caitlin, as you know, the hospitals do that. And I'm sure that the hospital systems have been seeking that help far and wide. But that's probably a better question for you.
Yep. I'll just add, the governor, we are, though, with the Maine Jobs and Recovery Plan, looking at those ideas. I mean, we think that Maine is a great place to live. And we think that given our performance during the pandemic, our quality of life, the economic strategy that we've been developing over these years pre-pandemic, that we really can attract workers. So there is loan repayment for physicians and nurses in the Maine Jobs and Recovery Act. We will be using some of that funding in marketing to bring people to Maine, but we also are going to try to encourage our young people in Maine to go into healthcare jobs. These are gratifying jobs. You can begin at an entry level and often find a career ladder to grow in place in some of these healthcare facilities. And we are really excited to be working in public-private partnership with our healthcare facilities, nursing homes, hospitals, clinics, to really ensure that in the short run, we're filling gaps, but we're also creating these good, high-paying jobs for the long run.
And I've personally talked with the chancellor of the university and President Dagler of the Maine Community College System, and with nursing home administrators and hospitals, and they are working together to fill these gaps as quickly as possible, and we're happy to help recruit.
Thank you. And my final question of mine, so a colleague of mine is looking at the vaccination rates in the state and where the virus is spreading. That data seems to indicate that spread is happening the most where vaccination is low. Is that y'all's understanding of how the virus is moving right now? Is that kind of a correct statement?
That is correct, Caitlin.
Yes,
And I'll take just a quick second to just put that in a bit of epidemiological context. There's a really common thought experiment in epidemiology. Take two identical states, both with, say, 1 million people in them. In one state, 3 out of every 4 households, or 3 out of every 4 people in every single household are vaccinated. Compare that to another state where 3 out of every 4 people are vaccinated, but not clustered by household. In the first situation, any virus is not going to have a lot of room to run, because the one unvaccinated person in every household isn't really going to be able to spread the virus to anybody else or get it. In a latter state where there's a lot more heterogeneity, clusters of people who are unvaccinated, there's a lot more opportunity to spread. Even though in both states, the vaccination rate hypothetically is 75%, the structure of who is vaccinated makes a lot of impact on where the virus can spread. That's really what we're seeing in Maine.
Thank you.
Let me go next to Amy Braun.
Thank you, Dr. Shah, Commissioner Lambrew, and Governor Mills. I was looking back at my notes, and a year ago today, there were 40 new cases reported, no new deaths, 17 people were in the hospital, and you noted at that time it was an area of concern because it was the highest number of people in the hospital since July of 2020. So I'm wondering, what did a state of emergency accomplish then that it couldn't accomplish now? And I know there are a lot of different factors involved, but what would be the advantages versus the disadvantages of re-implementing a state of emergency at this point?
Amy, a year ago, we didn't have any vaccines. And you know what we did during the height of the pandemic a year ago and a year ago last summer, what we did to keep people safe, and people came through and they did stay safe. And I think that data shows that people were conscientious about it. And we were waiting and praying and begging for a vaccine. And then December and January came and we got these vaccines. A state of emergency wouldn't change the availability of the vaccines. We have plenty of them now. And so the urgency is simply for individuals to step up to the plate and get vaccinated.
So the numbers in the hospital and the numbers of deaths, is that primarily, are you saying that a state of emergency wouldn't address that because those are people who are not taking advantage of the opportunity to get a vaccine and may not follow the other requirements of a state of emergency as well?
Amy, There's this Delta variant. I don't know if you've probably heard. There's a Delta variant that is highly transmissible, more highly transmissible than what we were seeing a year ago, and extremely dangerous and more deadly, as a matter of fact. And that's what we're seeing right now. I can't declare a state of emergency and wave a magic wand and make the Delta variant go away. But that's a major factor in what's happening today in hospitalizations and ICUs and ventilators.
Right. Okay. And people are starting to wonder about what the holidays are going to look like. I know nobody wants to look at a crystal ball, but one that's coming up pretty quickly is Halloween. Kids were not very widely trick-or-treating last year, and we're hearing from people who are wondering whether or not it'll be safe to take their kids trick-or-treating this year, or whether or not it'll be safe to answer the door for trick-or-treaters this year.
We haven't gotten to any Halloween guidelines yet, but I think it'll be safe. I suspect most trick-or-treating is outdoors, not in indoor spaces. We would look to the US CDC guidelines about masking indoors. Halloween outfits often include masks, so that's a good thing. But I suspect that we won't have a big problem with Halloween.
Thanks.
Thanks, Amy. Over to Annie from Spectrum. Annie, welcome.
Hi, thank you for taking my questions. First, for Dr. Shah and Commissioner Lambrew, at what point would the state take any additional action to deal with shortages of critical care beds, and what might that look like? I don't know if there are particular hospitals where those shortages are already becoming more urgent, but what would sort of the next step look like there?
I don't think we can do a lot of hypotheticals because it will be very circumstance specific. We do work with all of our hospitals one-on-one on their plans, as well as regionally, to make sure that we're cited on what's going on. They themselves often have triggers that they escalate engagement and escalate additional bed capacity. So we have not, and I should underscore this, we have not heard from a hospital in Maine that they are in the dire position that they do need additional help. We have provided equipment to some hospitals and other types of supports, but we at this moment are not at a phase where hospitals are saying that they need to trigger additional sites of care for their inpatients.
Great, thank you. And then for Governor Mills as well as everyone else, just one more. We've seen our vaccination rates start to sort of plateau, especially in the past month. And I hear the state urging more people to get vaccinated, but is there a specific strategy to combat vaccine misinformation specifically, especially as we head toward winter?
Well, thanks, Annie, for the question. I mean, we're vaccinating more than 2,000 people a day, providing 2,000 doses, more than 2,000 doses in shots in arms a day. That's progress. Every bit is progress. I note that the two major hospital systems have just this week come out with two big PSAs, I guess you'd call them, and they're all over social messaging. I took part in one of them, and they're two very different, but that's part of messaging that they're helping with, and we're doing messaging. If you see on TV and in social media, we're doing a lot of messaging about vaccines and how safe they are, how necessary they are, and why everybody who's eligible should step up to the plate and get a vaccination. Hit me with your best shot. Yeah.
Annie, I'll just note one of many examples. Making sure that folks are equipped with the right information, the correct scientific and accurate information. It's really been bedrock for us as throughout the vaccination process. For example, right now we've got a PSA that's running on radio and TV stations across the state, addressing one particular set of questions that has come up repeatedly around fertility issues, and underscoring utilizing Maine doctors in Maine who are experts in obstetrics and fertility medicine, reassuring folks that there are no adverse consequences to your fertility from getting vaccinated. That, again, has been a constant stream of questions, often tinged with misinformation. That ad is one that we started running not long ago and is out there right now, just as one example.
Thank you.
Let me go over to Patrick Whittle next.
Thank you very much. I wanted to first make sure I understood a couple of things. You mentioned earlier, I believe you characterized the day as being sort of a day of a dark record. Is the record the 88 people in ICUs, the number of people in hospital beds, or is it both?
Both.
Okay, got it. The number of people in hospital beds was, I believe, 226.
Correct. Right. That's correct, Patrick. And 88 in intensive care unit beds.
Yes. Governor Mills sort of addressed this earlier regarding the schools. Some of the school employee rates of vaccination are quite low, or less than 20%. You talked a little bit about this earlier, but would the workplace mandate that's coming from the federal government apply to those schools as it does to lots of public workplaces?
Well, it may. We haven't seen the language yet.
Okay. Does it depend on how many employees there are in the workplace? Like, does it have to be 100 or something like that?
That's one thing we've read, that it be employers of 100 or more and public employment, yeah.
Right, I see. Also, Dr. Shah, you touched on this earlier, but you're talking about the percentage of folks who are unvaccinated, the percentage of folks who have been hospitalized who are unvaccinated. I caught the number for the number of people in ICUs was over 90%. Is there a percentage for hospitalized folks who were not vaccinated prior to that?
Yep, sure, Patrick. It varies week by week, but over the past 8 weeks, it's been within a pretty solid narrow band of anywhere from 65 to 75% of people who are in the hospital in Maine with COVID-19 not being fully vaccinated. Some weeks it's been as high as 90%. Some weeks it's been a little bit below that. But again, it's been within that tight band of 65 to 75% in any given week, folks in the hospital not being fully vaccinated.
But 90% of those in ICUs.
Right.
That's correct, Governor. 90+% of those in the ICU not being fully vaccinated. There have been some weeks where, per report by the hospital, 100% of people in Maine ICUs were not vaccinated.
Right.
Not recently, but that has happened.
And could either or any of you speak to what kind of an impact this is having on the hospitals, and also any thoughts about why these numbers are so high when the state has one of the highest immunization rates in the country?
Sure. I'll take the latter one, Patrick, first, because there's a bit of math involved there, but then certainly on the former we can expand upon. On the latter, Patrick, it's a thing called the base rate effect. That is, let me ask a hypothetical, another common epidemiological thought experiment. In a world where 100% of people were vaccinated against the disease, there would still be breakthrough cases. And 100% of those breakthrough cases would be among vaccinated people. What we're seeing, in effect, is because there are so many vaccinated people in Maine, even a small number of breakthrough cases that require hospitalization, and it is an uncommon thing, but an uncommon thing that happens at scale can tend to be a high number of folks. That's basically what we're seeing right now in terms of that 65 to 75% vaccinated versus the remaining folks who are unvaccinated. It's just paradoxically a function of the fact that we've got a lot of vaccinated folks, and even uncommon breakthrough cases that result in hospitalizations numerically will look a lot worse than they are. In terms of the impact on the hospitals, Patrick, both Commissioner Lambrew, Governor Mills, and I have had the opportunity to speak quite frequently with hospitals, and we've heard firsthand the impact it's having on their staff, on their operations. And one thing that the governor noted, and I'll toss to her, is the impact that it's having on people who may need to be hospitalized, but not with COVID. And that's beginning to be a concern. If you need to be hospitalized for something other than COVID, not having a bed when you need it.
I think the hospital administrators themselves a week or so ago had their own press conference where they just begged people to get vaccinated.
Yeah,
they don't want to be overburdened And it's putting a burden on the healthcare staff, putting a burden on people who also need healthcare for other reasons, and they don't want to run out of beds.
So thanks, Patrick. And the last question for the afternoon goes to Terry Stackhouse from WMTW. Terry? Okay, well, we'll come back to Terry, or we'll answer his question offline. Oh, well, there he is. Terry? Okay, we'll get your question offline, Terry. Not a problem whatsoever. But Governor, I would like to turn things back over to you to wrap us out.
Oh, thanks, Dr. Shah. I listen to Dr. Shah too. I talk with him pretty much every day, and I listen to him on these news briefings when I'm not on with him. And I hear two things. One is people saying and believing, thinking that they don't need to get vaccinated because they feel immune, they feel healthy, they feel young, they're young. They don't feel that their chances are low of catching the virus. I think the data dispels that notion. The data that people who are unvaccinated are in the ICUs, on ventilators, fighting for their lives. And some of them are young. Some of them are many of them previously healthy individuals. You read the profiles in the newspapers and they're just very, very moving. So it can happen to you. The other way of thinking is, well, even if I do get it, I won't get very sick. Or if I get vaccinated, I still run the risk of getting COVID. Well, that's true. There are so-called breakthrough cases. But as Dr. Shah has said, the likelihood of your getting hospitalized is so much lower, and the likelihood of your dying is extremely low compared to people who are not vaccinated, not fully vaccinated. Well, cold weather is setting in. It's getting chilly in the evening, and the leaves are turning. And with warm weather leaving us, the activities we've enjoyed being outside all summer, all spring, we can't really take that for granted anymore. We've talked about masking indoors and not so much outdoors. Now there's going to be a lot more happening indoors. And I just want to beg people to take it much more seriously, take the masking protocols much more seriously, the responsibility of getting vaccinated more seriously. And listen to what people like Pope Francis have said. Vaccination is a gesture of love. Think about it that way. There's just no downside. And thank you, Dr. Shah, for teaching us today how to pronounce the word heterogeneity. Heterogeneity. I'm going to practice that one. Thank you, Commissioner.
Probably got it wrong too.
Thank you, Commissioner Lambrew, as well, for your time. Thanks, everybody.
Thank you very much, everyone. Have a good day.